Okay, I think we're live. Hi, everyone. My name is Dr. Karina Kaplan, and I'm the founder of this blog, Mygutmatters. And I would like to welcome today to our gut health chat Dr. Vik Rajan, who is a certified, board certified in internal medicine and also in integrative medicine, nephrology, and pediatrics. Dr. Rajan, welcome to our interview, our chat. Could you please tell us a few words about yourself?
Yes, so as Karina mentioned, I am board certified in 4 different areas: internal medicine, pediatrics, nephrology, and integrative medicine. The last one being the most important to me. Integrative medicine is the integration of holistic medicine with traditional medicine, and holistic alternative. There's a lot of different modalities. The thing that I utilize the most is nutritional medicine, nutraceutical medicine, and lifestyle modification therapy. Because what I talk about all the time is an algorithm of 6. Most of the chronic diseases that we have is not caused by a deficiency of metformin or Lipitor in our diets, but problems with our diets or exercise, sleep, stress management, isolation, and environmental toxicity. You fix those things, you'll generally fix most of the chronic diseases that you have. If you don't, then you'll just be on an endless cycle of medical pills and procedures or surgeries that may not fix the problem, may even give you another disease. And that's the way our traditional medical system is designed for. It doesn't take the time to spend with you fixing the actual causes. But that's what I try and do in my integrative medicine practice, Concierge Integrative Medicine of Houston. And love talking about that any chance that I get.
Well, thank you, Dr. Rajan. So you are both certified in a traditional medicine. You have a MD, but you're also a specialist in integrative medicine. You were certified by the Institute of Functional Medicine too. So can you please tell us what made you, because not every doctor is certified in functional medicine. So what made you decide to actually pursue that route?
Yeah, so going into integrative medicine, and just as a note, integrative medicine and functional medicine, technically they're 2 different certifying bodies, although their goals are very similar. It's just different ways that they started in terms of the groups. But how I got into that was actually a friend of mine introduced me to it. I'd known him since our residency days, and he told me about, hey, there's this, this place where you can learn integrative holistic medicine, and you can get certified. It's for MDs specifically, and I found that interesting. At that time, I was doing patient advocacy, which is helping people navigate the traditional medical system, which is confusing in and of itself. I had some extra time on my hands and started studying integrative medicine, and it changed everything that I thought I knew about medicine. For one thing, it changed the approach, because everything that I was taught of medicine involved figuring out which drug or which procedure that you may need, and when really learn about the causes of chronic disease, particularly in nutrition. I started applying this to cases that I would get for patient advocacy. First one being a girl in her 20s was having bile reflux as a complication of gallbladder removal surgery, and she had like 3 different gastroenterologists, 5 different medications, symptoms every day of like severe abdominal pain, nausea, vomiting, going to the emergency room once a month. Her dad was trying to help her navigate through the system, figure out things. It found me and said, hey, can you help us find a bile reflux specialist? And at the time, I was studying for my boards in integrative medicine, and I thought, you know, the real is not the purple pill or any other pills for that matter. It's really lifestyle modification, particularly nutritional modification, the modified elimination diet. And if you don't mind, I'd like to try that approach, see if it works. I said, okay, sure, let's try it. And it took a while to educate her on these things, because people in their 20s think they can eat anything they want, nothing will happen. But once she understood how why she needed to do it and what she needed to do, she did it. she became asymptomatic within a week. She
Oh,
got off of half of her meds within a year. She got off all of her meds within 2 years, and she's been fine ever since. And it was really, I mean, for someone who was basically symptomatic every day and going to the ER once a month to going to no symptoms, no meds, it was amazing to me. And that was the first case, but that wasn't the only case. There were other cases that I also saw, you know, some really amazingly good results with a nutritional and lifestyle modification approach. Um, and it just got to a point where I became a believer in it. I started working in a functional medicine practice for a while just to see how it works in an actual practice format. And then soon after, decided to start my own practice in integrative medicine, and have been doing that for the last couple of years.
thank you. Thank you for sharing that. It's amazing. And thank you so much. It's so nice to actually see the doctors who believe in nutrition and believe that food is our medicine, right?
Yes.
So can you tell us a little bit? You kind of touched a little bit about it, but what are the main principles of reverting the chronic diseases?
Yes. So as I talk about often is an algorithm of six that is out of balance for most everyone to a variable degree, and it's nutrition, and that's probably the biggest one of all. I'd say of those six, nutrition I'd weight it like three times. It's like half the battle right there is nutrition, but exercise usually a lack thereof. Sleep. A lot of people have problems sleeping. They have sleep apnea, undiagnosed sleep apnea, or improper sleeping can lead to poor quality sleep, which leads to not only just being fatigued and sleepy in the day, also slows your metabolism, makes weight loss more difficult. I had a patient who couldn't lose weight despite diet and exercise modification until she got her sleep apnea addressed. And once she addressed that, we got her diagnosed, put her on a CPAP machine. She lost 20 pounds within a couple of months. And it's
Wow.
like, that's what it took. Yep, that's what it took. So sleep is a really big one. And stress management. A lot of people are stressed out in life, and sometimes you can fix the stressors, sometimes you can't. If you can't fix the stressors, you have to fix the way you deal with it. Some people deal with it poorly, whether it be alcohol, tobacco, drugs, or even other things. Overeating, that's a big one. And, stress eating, leading to weight gain and leading to, a lot of your autoimmune diseases that are so difficult to treat with immunosuppressants from a conventional medicine standpoint, not to mention the side effects you get from immunosuppressants. They can be actually dealt with things like an elimination diet and stress reduction techniques. And I had a patient who had new onset rheumatoid arthritis. Was getting pain, swelling in his joints, rashes everywhere, and I told him, you need to do an elimination diet. You need to work on your stress. You have to do things, and also sleep apnea too. He had that. So if you're not getting good sleep, then you're going to be more stressed out. So all those things you have to address, and upon addressing it, uh, and particularly with the elimination diet, as long as he stayed on that, his symptoms went away. He didn't need any medications. Now, keep in mind when you make these changes, it's permanent. It's not temporary. You have to make these changes for your life. And if you try and go back and cheat, symptoms are going to come right back. And I've had some people learn that the hard way. And it's like, oh,
Mhm.
I'm good now, right? I did the elimination. I eliminated the foods that are causing me problems. Now I can go back to eating them. Nope.
Mm.
I mean, or even things like weight loss reduction. I had some mild insulin resistance that diagnosed a couple of years ago doing SpectraCell testing, which is some enhanced cardiometabolic testing that you don't normally get with regular labs. Diabetes runs in my family. I wasn't overweight to begin with. It was borderline, like a little bit extra stomach weight, right? And so I had to lose that. Now I tried diet and exercise, and in particular with diet low carb. A lot of people say you need to cut fat. Well, going low fat made us eat more carbs, and carbs is actually worse than fat because carbs you end up feeling hungry, compared to fat, so you end up eating more. And carbs increases insulin. Insulin controls your blood sugars, but insulin also makes you store more fat. So the real answer
Hmm.
for weight loss involves carb reduction. I did those things. I lost 10 pounds, but then it was stuck. So then I added a couple of things. This is where the nutraceutical medicine comes in. Nutraceutical basically supplements. A lot of people get in the store like things like omegas, vitamins, probiotics, but in most stores that are sold to the consumers, the quality is low or the concentrations are too low, the dosages are too low for it to work. And so the ones that are of higher quality are usually available to medical practitioners, and that's the ones that I use. And for me, I use a combination of a high dose probiotic and fiber, and doing that every day, particularly the fiber with water before meals, 3 times a day, lost another 10 to 15 pounds. And so I ended up losing close to 25 pounds and got, it was the weight went off, the insulin resistance went away. And it's been like that for now the last several years. So those kind of things, whether it be carb reduction diets, elimination diets, nutraceutical therapies, these lifestyle modification, these are the main things that I utilize on my patients to help minimize or potentially eliminate the need for prescription drugs or medical procedures.
Wonderful, thank you. So you mentioned that there are six pillars. One of them nutrition,
Yeah.
another one exercise, then sleep,
Sleep,
stress,
stress management, isolation, that's another one too.
isolation.
Yes,
Hmm.
people are too isolated, whether it be in familial isolation, social isolation, spiritual isolation. Any one of those things ends up leading to oftentimes to depression, which then makes you more stressed, and that just leads to more problems. I mean, depression itself, we know what it can lead to,
Yeah.
but it also makes any condition that you have worse.
Hmm.
And last but not least, environmental toxicity. So issues with water. You should be drinking filtered water. Issues with
Hmm.
air. Changing your air filters. Sometimes where you're at too. I had someone who had adult onset asthma and was living in this new apartment complex. Well, it wasn't new. She moved there, but the apartment
Hmm.
complex was old and not very clean. And she was getting these asthma symptoms when she was in the apartment. When she was outside or anywhere else, it was fine. I said, well, in this case, and her doctor had put her on all these inhalers and stuff. It's like, you may not
Hmm.
need it. You may just need to move. And
Yeah.
she ultimately did. And when she did, she went to a better apartment complex and didn't and ended up not needing her inhalers anymore because symptoms went away. So yes,
Amazing.
environmental toxicity can be a big thing. Not to mention, you know, we think about air and water, could be the people around you. Maybe you have a toxic environment of people. Some people say,
Mhm.
work, my work is killing me. The people around me are toxic. It's like, well, if it's killing you, then yeah, it's probably true. It's probably causing you these diseases. And I had someone who was having that problem, and she ultimately had to change jobs in order to get rid uh, of that stress, and it also got relieved a lot of her medical problems. Their symptoms decreased substantially upon changing
Mhm.
environments. So all of those things are important, and we just don't pay enough attention to it. Sometimes people aren't willing to do anything about it. It's like, well, this is what I'm used to. This is what I'm going to do. I'm just going to stick with it. Well, that's your choice. But then don't expect the diseases to go away. Expect to
Mhm.
be on more pills, more procedures that may or may not control it. And,
Mhm.
so not everyone is going to do it. Just like, the smokers. Not everyone's going to quit, even if they have lung disease. There's
Mhm.
some smokers. They have a hole in their throat and like, I need a cigarette. No. there, there's nothing you can do for them. But for those who want to get off uh, the the traditional pills and surgeries and want to take ownership of their lives and their
Mhm.
health, then integrative functional medicine is exactly the approach they need, and they can do quite well with it. It's something that, unfortunately, most of the doctors don't don't do, because they don't even know it themselves. First of all, you have to have trained in that. That's not something that I learned in medical school or residency, and most doctors don't even live that lifestyle themselves. You
Mm.
know, for example, if they say 2/3 of Americans are overweight, 1/3 of doctors in America are overweight and on the same prescription drugs as the patients.
Yeah.
How are they going to teach health when they don't know it themselves? And I've seen that. I saw one doctor. It's like, she was diabetic, overweight. She needed an extra med. She was saying, "Oh yeah, I'm gonna need to go up on my medication." I'm like, have you thought of carb reduction diet? And it's like, no, no, I don't have time for that. I'm not going to do that. Well, you know, that person is not going to be able to teach good health to any of her patients. What she will teach is how to get on more drugs, because that's
Yeah.
what she knows. So,
So why do you think we have such a problem? Why are they not teaching doctors to be how to eat well?
well, for one thing, or again, this our traditional system doesn't really spend a lot of time on it. I mean, I think to a certain extent they don't even believe it themselves. I mean, or they pay lip service to. I think we all have an addiction to bad habits as well, and
Hmm.
doctors is included in that. I mean, if you look at in training, and we go through medical school residency, it is long hours. You're not getting enough sleep. You're stressed out. You're not,
Hmm.
you may not have time for exercising. You're eating whatever is available. I mean, none of, so you in your days of formative training, your entire life is the opposite of integrative or functional. It's
Yeah.
basically poor. You're just trying to survive and take and get these patients, you know, stabilized and not dying in a hospital, because that's where you're working most of the time, is in the
Hmm.
hospital. When you're in a hospital at that point, yeah, at that point you really can't be talking about integrative functional medicine, because these people are dying. And you're just
Yeah.
trying to, and that's where there is room for traditional medicine. When someone's in an emergency, acute medical situation, severe health problems, yes, a traditional system can get you out of the hole and prevent you from dying. It
Hmm.
is effective in that. It's just when it comes to outpatient chronic disease prevention and management, that's where our traditional system is weak, because it relies only on the pills and the procedures, and there's more to it than that. It's the nutrition and the lifestyle modification. But again, if we didn't learn that in our training days, and in fact, if anything, we learned the opposite. How are you gonna teach that once you're out in practice? There's a lot of things that that we are taught in our training years, that when you go out into the real world, it's the exact opposite. That's not, and unfortunately, that's just the way the system is designed, and it's very slow to change. And so, um, yeah, that's so you're probably not going to hear much of these things, or if you do, it's going to be like for a minute or two, or maybe a
Hmm.
handout, which is basically lip service, but it's not enough to really create any change, because old habits die hard. You're not. It's not going to change by someone telling you for 30 seconds. Eat right, exercise, don't drink or
Yeah.
smoke, and I'll see you in 3 to 6 months. It's not enough. I mean, the coaching that I've done with my patients takes some the order of hours, and
Hmm.
but that's what made a difference. Without that, it wouldn't have changed.
But doctors do know that, for example, type 2 diabetes can be totally reversed by the lifestyle, right? It's not a genetic disease.
Well, actually, if you ask some doctors, they would probably say no. A lot
No.
of them say once you, I mean, uh, you can prevent it. See, here's the thing. We talk, a lot of them talk about lifestyle nutrition in terms of prevention. Yes, prevent it. Once you have the disease, say, well, now you're stuck with it, and you're going to be stuck on the pills and the procedures. That's not true, though, because I have seen some patients get off the pills and diabetes pills by getting rid of their weight. And
Hmm.
as long as you're not to the point where you're insulin dependent, now if you're insulin dependent, that means you've worn out your pancreas and it doesn't have any more juice to give. And then, yeah, you might not be able to reverse it. But short of that, if you're just on pills, yes, of course you can reverse it. Get rid of the weight. and that involves some major carb reduction and regular exercise and getting down to a normal weight. And you have to do that, and maybe some supplements too can help, like the probiotics and fiber and other things. If you do that all the time, then sure, you can get rid of the diabetes. But it's just a matter of how dedicated you are to doing that. It takes time. It
And
takes,
whether doctors and whether you have doctors supporting you, right?
yeah, and
Rather
also,
than putting you on pills.
yeah, and also, I mean, it's an investment not only in time but also in the money too. Because here's the other thing that people don't realize: and most people get their medical care through their insurance. Problem is, insurance doesn't care about your health. It's an illness system, and it's not a wellness system. They make more money off of a sick population than a well one. And if you want to understand why, just look at the economics of it. The sicker the population, the more they'll charge for premiums over time. The more they charge for premiums, the more money they make, because they make a percentage off of all the premiums they collect. So a sick population that costs, say, $100 billion, they're going to make, and they get 10%, off of that. They're going to make more money than a well population that only costs $10 billion, and they get 10% off of that. So there's no incentive for them to make everyone well. If anything, they don't even they don't like to pay for the time it takes to educate the patients about it. And that's why, people complain, oh, my doctor hardly spends any time with me. Yeah, because if we do, you're going to go out of business, because you have to be seeing patients every 15 minutes in in order to pay the bills for overhead for running a clinic. If you're going much slower than that, you're you're not going to be in business for very long. And that's the reality of insurance-based medicine. Because of that, that only leaves time to basically, order the labs, do the medication management, and or refer to another specialist who will do their own, whatever procedures or things like that. And that's what insurance pays for: drugs, procedures, not time, not integrative functional medicine coaching, not nutritional supplements. No, they don't care, and they won't. And so, what does that mean? It's out of pocket for the patient. And some people just, aren't willing to invest in their health. They'll invest in their car sooner than their health, or something else, or luxury items, or cosmetic procedures,
Smartphone.
but not in their health. And here's the thing: health is one of those commodities that people take for granted until they lose it. Once money you can always get back. If you're smart enough and you work hard enough, you can always get money back. But health is one of those things that when you lose it, you may not be able to get back, no matter how much money you spend, no matter which facilities you go to, no matter how great the place. Once your health goes, it may be permanent, depending, especially if you're just doing a traditional medicine approach. And so, people need to invest in their health more, and that's just the bottom line. And they need to go to places and into systems that are invested in getting them well, as opposed to
Rather than getting them sicker.
maintaining their illnesses
I
and,
agree.
and symptom control.
I agree. So there is another question I was also thinking, and someone else in our actually closed group was thinking too. So the cardiovascular diseases are on the rise. It's one of the major causes of death, right, in the United States, but also in all other parts of the world too.
Yes.
So what can be done? Do you think that maybe there are more tests that could be done to prevent the disease, like, for example, C-reactive protein test, or I don't know, something else that patients.
It's a of I mean, yes, we're aware that inflammation also contributes to heart disease. Inflammation, though, is one of those difficult to treat things from a traditional medical standpoint. And what do? Give them anti-inflammatories? Guess what? There's drugs called non-steroidal anti-inflammatory drugs. If you give those, it actually though causes heart disease. All the
Mm-hmm.
stuff on like Vioxx, Celebrex, even your ibuprofens now, they have warnings in the back. Taking those for chronically can contribute to heart disease, heart attacks. And so, no, it's not that simple. What the best thing one can do is, again, an integrative medicine lifestyle. And, as far as getting to normal weight, getting proper sleep, exercising every day, trying to keep your stress under control, or do best stress management techniques that you can do, like
Mm-hmm.
meditation or yoga or prayer or whatever works for you. Anything other than alcohol, tobacco, drugs, or overeating, and
Mm-hmm.
and not being isolated, healthy environment. Those are the best things that you can do for yourself. And then, to the extent that you have heart disease and you may, or you have high blood pressure, you may need some medications to control, so be it. But if you if you do the integrative stuff, that's actually the first line. All the drugs and everything, the procedures are all second line. And yes, if the disease is severe enough, you may have to do that first. And like if you're having a heart attack, I said, don't go to the naturopath for some herbs and spices. Go to the cardiologist, get yourself a
Mm-hmm.
cath, save your life. And then after that, talk to a functional or integrative medicine doctor about what you can do to prevent this from happening again.
Mm-hmm.
But yes, so that's the real thing. I mean, all the pills, and there's always something, oh, this pill will prevent this pill, this, and there are some that that may help. But again, if you're not making the changes in your nutrition and lifestyle, then you're not going to get the best outcomes, no matter what traditional medications or procedures you're doing.
So, what do you think would be the best diet? You're talking a lot about nutrition, change the nutrition. So, for example, for those people who want to prevent their themselves from heart attack and
Yeah.
different heart diseases, what would be the best?
Well, so there have been studies about different types of diets that are good for preventing heart disease. Some famous ones involve the Mediterranean diet, which if you
Mm-hmm.
Google that, you see a lot of that in people who have in these Mediterranean border countries that have that particular diet. They tended to have less heart disease as they switched to a more processed and Americanized diet. Then they started having more heart disease.
Mm-hmm.
And so, you know, other things, vegetarian, a vegetarian diet can also be good. Um, what the, it all depends on also like some people are, like meat, and there's nothing necessarily wrong with that. Although some meats are better than others.
Mm-hmm.
Red meat is associated with more risk for heart disease, colon cancer, and so minimizing that is actually probably a good thing. In which case, then what type of meats would you do? Well, maybe like chicken or fish, which is the healthier kinds. But vegetarian, you can do that. The only thing I say is if you're vegan, be careful. Some people, because some vegans get vitamin and nutritional deficiencies because
Mm-hmm.
it's a very limited diet because they don't take any dairy or eggs or anything else, so they can be low on B12, iron, and other things. Um, I generally talk about low carb or high protein. That's kind of what I follow myself. And by high protein, I say anything that has more than 5 grams of protein. If you look at the back of a box, nutrition,
Mm-hmm.
the serving, you say how much protein, how much carbs. Because some diets they require a lot of carb counting or calorie counting, and I don't do that. It's too
Mm-hmm.
complicated. I don't know too many people who can keep up with that long term. Maybe short term, but not long term. So I just look at the back of it and say how many grams of protein does it have per serving. If it has more than 5 grams, then it's probably okay. Whatever the carbs or the fats, it'll be balanced. But if it has
Mm-hmm.
5 grams or less, then it's probably going to have an excess of carbs or an excess of fats. And that's the type of stuff that you want to minimize. The things that are the types of foods that are less than 5 grams, often involve, we're not just the junk food that we think of, like chips or candy or pastries, but things that we don't necessarily think of: bread, pasta,
Hmm.
rice, noodles, uh, you know, uh, even even things like oatmeal. And say, oh, it's whole grain. Yeah, whole grain. Yes, it is better than than white or enriched or refined
Hmm.
breads. But at the same time, if you are really overweight or you're diabetic, you got insulin resistance, you need to cut down on carbs. Even whole grain can still be a bit of a problem. I mean, it's only half as bad as enriched refined
Hmm.
carbs, but it's still a problem because you're not tolerating carbs. So you have to go, uh, as low as reasonably possible. Now, some people go as far as ketogenic, which is like ultra low carb, and you do lose weight, a lot of it. The problem is that you are so low carb, your brain actually needs a certain amount of carbs to function properly. And if you go ultra low carb, you don't get enough carbs for your brain, so it has to operate on ketones, which is something that's a breakdown from fats. So it
Hmm.
uses fats to break it down. But when you're in ketogenesis, your body's operating on ketones. You may feel a little bit fatigued, you may feel a little bit brain fog, and it's just really hard to sustain ultra low carb. So what often happens is I hear people who say, "Oh yeah, I was on a ketogenic diet and I lost a lot of weight." I'm like, and then I had to stop. Why? I just couldn't keep going, or for whatever reason. And then I gained all the weight back.
Yeah.
That's why, you know, it's just hard to sustain. You know, but a low carb, not necessarily ultra low carb, but just low carb in general, that's not difficult to sustain. And I do it by look for things that are high in protein, and that'll cut out most of the foods that are high in carb. That's what I do for myself. That's what works, and that's what's been able to keep off the 25 pounds, along with probiotic and high dose fiber, which I still take twice a day, and it's good. And so it's just yeah, nutrition is the biggest thing. And as far as exercise, you don't have to do a lot. You don't have to do P90X or some other some other insane exercise routines in order to do it. If you like it and you don't injure yourself, that's fine. But all I do is just 15 minutes a day of walking,
Hmm.
maybe a little bit of light weight training. That's it. Nothing big, nothing fancy, but uh,
You
but
just need to move, right?
to move, and yes, and that's the other thing, moving. Most people actually, people think, like, a lot of people have desk jobs. They sit in the chair all day, they don't get up, and then at the end of the day say, okay, I'm going to do 30 minutes of exercise. There's a study that said that sitting all day will successfully reverse 30 minutes of worth of exercise a day,
Hmm.
because your metabolism starts to slow down after about an hour of sitting. So
Hmm.
the best way to actually exercise, you don't have to wait till the end of the day to do it. Just get up and walk around every hour, even if it's just for like a minute or two. Do something every hour, and that actually is more effective than 30 minutes of exercise at the end of the day. It's just getting up and doing a minute or two of exercise every hour or two. So
Great advice.
yeah.
Thank you. Thank you. So, can you tell us a little bit more about your case studies? Maybe something interesting that you would like to share
Yeah, there's a
from
lot.
your own
So
integrative practice.
yes. So one of my other early cases using a nutritional medicine approach, I actually had a retired physician come to me who had bad asthma and allergies. He was on all his inhalers, and he was even on prednisone, oral prednisone, and yet still feeling difficulty breathing. He had a concierge doctor, traditional one. He had a pulmonologist. I think he'd even been to an allergist once, and yet uh, he still felt like he couldn't breathe. He was also having problems with brain fog, memory problems, imbalance. This was all being managed and worked up by a neurologist. Couldn't figure out what was going on, but it was in the process of the workup. And then it was having these heart rhythm abnormalities. He was seeing a cardiologist for that. And they were trying to figure out what was going on. And he came to me, again, he was looking actually for patient advocacy, navigating the system, because he had all these specialists, none of them was communicating with each other. He said, hey, can you help go to my appointments, help figure out what's going on? And again, at this point, I was, certified in integrative medicine. I said, have we looked at what you're eating? Has anyone looked at what you're eating? Have they even done a food allergy testing? And they didn't. They did air allergy testing, but not comprehensive food allergy testing. So we got that done. It turned out he was allergic to corn, which he was eating every day. On top of that, corn is in our diets in many other ways. Look at high fructose corn syrup and see where you'll find it. You'll find it in a lot of foods. Mm-hmm. So I had to educate him on how to avoid not only corn, but any foods that have corn-related products in them. But once he did that, eliminated it, his symptoms got a lot better. He's able to get off of his prednisone within a month. And so, but what was even more surprising to me, because I figured, okay, yes, you're avoiding a food allergen, your allergies and asthma should get better. But other things that got better was his brain fog, his imbalance. Was his brain fog, his imbalance.
I think I lost you. I'm not sure if everyone else can hear you. I think I... Yeah. I'm sorry, I don't... Okay. I think we lost him. I really apologize about that. So we'll see if maybe he will, if Dr. Rajan can join us back. Maybe he lost his internet connection. Just give us a little moment. Let me see. Hello? Okay, I'm so sorry. Okay. Okay, yes, please, if you don't mind. Okay, thank you. We're waiting for you. Okay, thank you. Bye. So that was Dr. Rajan. His iPhone overheated. We apologize about this technical difficulty. If you do have any questions, please comment. I'm gonna read them out to Dr. Rajan when he joins us back. I can see that there is one question from Alla Dmitrievna about insulin resistance. If you have any more questions, please feel free to post them right now. And hopefully he will come back in just a second. Okay, I think he's coming back. Oh, hello. Welcome back. Yes. Welcome back.
My phone overheated and needed a rest, which goes to an interesting thing about sleep. Even machines, yes. I was told by a computer expert, like laptops, if you leave them on all the time, their lifespan will actually go down.
Yes.
Because it said you need to actually put your machine to sleep. Even machines need sleep. And yet so many people go out there with lack of sleep and wonder, why is their body breaking down? If a machine needs sleep, you think our bodies don't?
So, of course, yeah. I mean,
but
it's
anyway,
not...
Yes.
It's not a brainer, I know. But people just always think that there are so many other things that are more important than their sleep, and
Yes,
then they pay for it the hard
yes,
way.
yes. And oh yeah, so going back to my patient, yeah. So his other conditions, when we got off the corn, his brain fog, his imbalance, his heart rhythm problems, they all got better, and that was the part that I didn't expect. But
Hmm.
it showed me that everything is interconnected, and so if you fix one thing, you may end up fixing a whole bunch of other problems, and that goes back to that algorithm of six. Most of the chronic diseases are caused by that. Fix that algorithm, and then most of your diseases, even if they seem all separate and not related, they actually may be quite related,
Yeah.
and it just all gets better. And so, yeah,
I think that's another problem that a lot of the traditional doctors don't see, that our body is a whole, it's a complex system, and things are interconnected.
yeah,
Our gut is connected through the nerves and through the endocrinal system, and it's all connected. So we can't really just work on a separate organ, right? Because
right.
this inflammation can come from one part, but then affect all other parts of your bodies.
That's exactly true. It's just that our scientific system is designed to break things down into parts and components, and because that's just the way that they understand things. They don't really understand interconnectedness. When you look at studies, they try and break it down to one variable on and or off. And so,
Mhm.
like when they look at supplements, oh, a supplement doesn't work. They just do study one supplement with no other changes, and say, "Oh, see that one supplement didn't work, so it doesn't do anything." That's because there isn't any one thing that does it. Like supplements is like, for example, I compare it to like it's supplement medicine is like combination medicine. You have to find the right combination for people. There isn't any one thing that's going to fix it all. Just like, for example, if you're dealing with cancer, chemotherapy, there isn't any one chemotherapy drug that fixes cancer by itself. It
Mhm.
doesn't. It's always done in combination. And if you try and study it in isolation, then you're not going to get impressive results. And then you may look at it and say, well, see, it does. That drug doesn't do anything. Wrong. It does in combination. You're just not studying it right. And that's the problem in the way our scientific studies are often conducted for integrative medicine. They look at one thing in isolation and then say, oh, see, it doesn't fix everything. It's not good enough. It will if it's done in everything else. I just, for a more simpler example, I say, what if we did a study on plant health, try
Mhm.
and figure out what makes a plant healthy? Well, you need sunlight, water, soil, right? Well, suppose we just give sunlight and water and soil is no good. Okay, it dies. Then we just give
Mhm.
water, sunlight, and soil no good. It dies. Soil, the other's no good. It dies. And then we say, well, see, as you can see, neither sunlight, water, nor soil make any difference in plant health whatsoever. I mean, that would be the conclusion you come up with if you're looking at it in isolation. But, common sense, we know that's ridiculous.
Yeah.
Because you need all three of them. But if you're breaking it down to just one part and the other parts aren't where they need to be, and that's the
Mhm.
thing, for when they're breaking down one thing, you know, again, I said most people have multiple disorders in the algorithm of six, so they're just fixing one little piece, and the
Mhm.
others are not in balance. Of course, you're not going to see the best results. You might not see
I
any results because you still have other things wrong. You got to fix them all. When you fix them all, then you see you see things really worked. And so that's yeah, that's kind
I
of what
love this
it is.
example about plant. I didn't even think about it. Yes, it's amazing. There are so many things that are important. We have a couple of questions here. If you don't mind me, I will ask you. So one of the followers is asking, what about insulin resistance? We did talk about a little bit about it. Can it be reversed or only kept under control with diet?
Yep, because I did it myself. I had insulin resistance. Didn't have diabetes, and blood
Hmm.
sugars were still normal. But insulin resistance is what comes first before the blood sugars become abnormal, and before you get to the point of being diabetic. And yeah, you. carb reduction,
Mm-hmm.
and that I took some additional supplements for
Mm-hmm.
additional weight loss. Get rid of the weight, then you get rid of insulin resistance. And I've seen that for patients who had full diabetes and were on several medications. As long as you're not to the point where you're insulin dependent, if you're insulin dependent, then you may not be able to reverse your diabetes at that point. But at the very least, you can decrease your need for insulin, because one of the things, when you get on insulin, it actually makes you gain weight, which then makes you need more insulin. And so these people end up just on increasing amounts of insulin,
Mm-hmm.
and there's nothing they can do about it. And they're stuck at that point. So. Uh, as long as you're not insulin dependent, yes, you can reverse your diabetes at any time. But even if you are insulin dependent, if you take an integrative diet and lifestyle seriously, you could at least reduce your amount of insulin that you need, and that itself is a victory in and of itself.
Thank you. Another question: I started having gut issues like severe belching, cramps, gas this summer. Took doctors 3 months to diagnose H. pylori. It
Mm.
took 2 months to get better after antibiotic treatment. Now, after 1 month of normal life, having same issues again. What would you suggest to do? And do you consult on Skype?
Okay. So H. pylori, that's an interesting one. That is one of those where a lot of people for gastric ulcers, duodenal ulcers, and in the past used to think, well, it's just a diet and lifestyle kind of thing, and it turned out that someone discovered several decades ago that there's actually a bacteria in people's guts
Mhm.
that can contribute to this problem, and he went so far as drinking a culture of his own bacteria to prove it, and he ended up getting the Nobel Prize for proving that a bacteria can cause the ulcers. And so, to the degree that yes, you take this H. pylori treatment, which is an two drug antibiotic combination along with an acid blocker, it can treat it. Sometimes if you're still having symptoms, it may require additional treatment because it may not get resolved at the first time. But another possibility is that if you don't have H. pylori anymore, when you're on antibiotics, it also messes up your gut flora. Not talking about the one in the stomach, but the ones in the intestines, going
Yeah.
further down the gut. And if that's out of balance, you can start having irritable bowel like symptoms. And the treatment for that is actually probiotics. That helps quite a lot. On top of that, some people have intolerances to certain foods, and that can contribute to reflux symptoms, irritable bowel type symptoms. And so, an elimination diet is what would be done in order to get that under control. As far as consulting over Skype, yes, I can do that. I've done that over, like I said, over video. I've done it over phone, email, text, of course, in person. Most of my people are in Texas. As far as for if they need medical treatment, by virtue of licensure rules and regulations, yes, if I have to like prescribe or treat something, then it does have to be within the state of Texas. But if it's just health coaching, and you have other doctors that are prescribing and treating, then that's something that could be done uh, out of state. And I've had a few people take me up on that. So that, for
Mhm.
health coaching things, that's possible, because that's something that your doctor will never be able to do for you.
Exactly. Thank you. Another question we have from another person. I know people have cholesterol. So she knows some people who have high cholesterol, but
Yes.
they're on good diet at the same time. So what can cause high cholesterol? Can it be not diet related?
So, some people do have genetic predisposition to high cholesterol. There's conditions like familial hypercholesterolemia, where you know they, they they just have high cholesterol, and that can be a problem. Having said that, though, a lot of it tends to be more diet related than people
Mm-hmm.
realize. And I'd be interested in seeing what exactly are they eating. You know, sometimes some people, for example, uh, in their efforts to go holistic, and yes, fats, the bigger problem is not so much uh, fats as it is carbs. Having said that, if you're having a cholesterol issue, the types of fats you're eating can play a role. For example, in a lot of alternative medicine world, a lot of people like coconut, coconut
Mm-hmm.
oil. So, oh, you should take plenty of it, and a little bit of in moderation is okay. However, coconut has a high amount of saturated fat. I have seen a few people that went high on coconut, took a lot of it, and then their cholesterol went up to the roof. And they're like, "What
Mm-hmm.
happened?" It's like, well, it's high in saturated fat. The healthiest type of fats are your monounsaturated fats or your omega threes that you can find in, like, fish or something like that.
Mm-hmm.
Uh, so types of oils that you also use for cooking can also matter too. So you got, on one hand, you don't want ones that are high in so there's ones that are polyunsaturated, but that traditionally I used to think they were better, but it was high in omega 6 content, and
Mm-hmm.
omega 6 can be pro-inflammatory, and to the extent that we know inflammation is a major contributor to heart disease, even more than cholesterol, that's a problem. So you want to find things that have a better, less omega 6, more omega 3. Something like canola oil can do that, or something that's high in monounsaturated fats. Olive oil is a good example.
Mm-hmm.
Uh, and ones that are high in saturated fats, then you want to limit that. So something like coconut oil is really high on saturated fats. So you want to cut down on that. If you're taking meats, particularly like beef, if you like eating the gristle and all, cut down on those things. Other things that can help with cholesterol, though, fiber. Fiber actually helps decrease the absorption of cholesterol. And if you take that 2 to 3 times a day, that has been well associated with cholesterol reduction levels. That's actually
Mm-hmm.
known in traditional medical studies. It's just
Mm-hmm.
not commonly used by traditional medical doctors for whatever reason. But the
Mm-hmm.
studies are there, and in combination with, I think, good probiotics. Some other ones that are associated with cholesterol reduction, I think, is berberine. Berberine is a type of herb that also has been shown to help decrease cholesterol. Of course,
Mm-hmm.
exercise that can help. Red yeast rice, which is actually where statins come from. People talk about, like the Lipitor and all that. That actually came from an herbal product from red yeast rice. The active ingredient in that was a statin, and that was found to decrease cholesterol. It's also found to decrease inflammation, which
Mm-hmm.
is why the statin drugs, at least from cardiology standpoint, are considered so popular. They think, though, it's because, it's a cholesterol reduction. Actually, it's more of inflammation reduction, because there's other drugs that lower cholesterol, but but don't have as much of an influence on whether you have heart disease or not, and the progress of it. But statins, for some reason, do. Now, if you're uncomfortable with taking a pharmaceutical statin, then your alternative would be red yeast rice, which can also work because it has that ingredient in it. In fact, that's
Mm-hmm.
where the statins came from in the first place. So,
Yes. Thank you. And we have a couple of more questions. So a lot of people also have heartburns, reflexes. So
yes.
what would be in your opinion, the most common reason for those? And what would you recommend?
Dietary. It's dietary
Mm-hmm.
until proven otherwise. I mean, you could take your acid blockers for symptom
Mm-hmm.
control, but in the end, that's not really going to fix the problem. And in fact, if you're being on your Prilosec or other, like, strong acid blockers, has been associated with things ranging from increased risk of infection, because you need a certain amount of stomach acid to prevent
Yeah.
to prevent bad pathogenic bacteria from entering your body. It also associated with nutritional deficiencies, as well as kidney disease. And so, you don't. So suppressing acid is a short run solution, but not a long run. So what's the real solution? One, losing weight. If you're overweight, puts more pressure in your stomach, causes things to go up into your esophagus, the stomach
Mm-hmm.
acid, and that contributes. The foods you eat, obviously spicy foods, but there's actually other kinds of foods that can trigger reflux. Things ranging from like I think tomatoes, for
Mm-hmm.
example. I think garlic may, onions. There's a few foods I have on my modified elimination diet that eliminate for people who have reflux because it can actually trigger it. And the people who have done it, they find out, oh wow, oh of course, caffeine, chocolates,
Mm-hmm.
those things also trigger it. So when you eliminate those things, then you have much less problem with reflux, and so that you don't need your medications so much. And that's the real treatment. And it works for acid, and it also works for bile reflux too.
Mm-hmm.
Because so, which is even more difficult to treat than
Yeah.
acid reflux. So
Thank you. And the last question is, so child gets strep throat a lot. Is there a diet that could improve immunity against that kind of disease?
hmm. Well, perhaps. I mean, I think. Well, some of the, so one of the things, if getting strep throat a lot is like, well, why is he getting strep throat? First of all, is he getting enough sleep? If you're not getting enough sleep, your immunity is going to be cut down in half. And I know, because I find myself, well, I don't get strep throat, but I'll get a cold very easily if I find myself not sleeping enough for more for a couple of nights in a row, and then I end up getting a cold. And so, and then yes, the types of foods you eat. If you're eating junk food all the time, candies and whatnot, yeah, your immunity is going to be less. Another thing, vitamins. And also, a couple of things that help prevent colds and may help with strep throat too, like vitamin C and zinc. And finding if you're not getting enough of that, sometimes I give that to my kids if they're exposed to someone with a cold or they're starting to get cold symptoms. I'll give them like a zinc coldies.
Mm-hmm.
It has it in a spray, so if your kid can't do a lozenge, you can just spray it. And then vitamin C, chewable.
Mm-hmm.
Take one of those uh, and break it in half and give it to them. And uh, I mentioned sleep is a big one. And of course, the other thing too is just the environment. I mean, if you're around, if you're in daycare, you're in school, everyone's sick. Yes, I mean to a certain extent, getting you do get a certain amount of colds every day. In rare cases, there are some kids that have immunity issues, and if you find yourself getting much more frequent. It depends on how often we're talking about. I mean, like it's normal for a kid to get some sort of upper respiratory infection, every couple of
Mm-hmm.
months. That's part of growing up. But if you're getting it like, you know, every couple of weeks, on the other hand, and maybe talk to your pediatrician, make sure that their immune system is proper, because in rare cases that's I have seen that, and that can cause it. But at the same time, that's a rare thing. More common things, you know, make sure your diet's good, make sure you're sleeping well, vitamins, probiotics,
Mm-hmm.
like that. That's probably going to fix the problem for most people.
Mm-hmm.
But at the same time, you're not necessarily if you're expecting your kid never to get colds, don't expect that
Edma.
either, because that's
Yeah.
just a rite of passage growing up. I mean, my kids, they eat healthy, they take vitamins, they take they take everything, and yes, but once in a while they get a cold. I mean,
Yeah.
they're 3 and 6. It's that age. I mean, so, but oh,
It's a
another thing
matter.
too,
Mhm.
allergies. If they're having
Yeah.
allergies, that's another thing that can predispose you to getting colds. So if you're having allergies, then you got to make sure you deal with the allergies, because that means stuff isn't draining well. If stuff doesn't drain properly, infections come more easily. So fluids and stuff that sit around and they're not moving, they
Mhm.
get infected more easily. So that's another thing. Don't want to forget to mention. So.
Yes, thank you. Yeah, it's not a matter of whether they're sick or not. It's a matter of how hard they sick, right? How whether they get complications or not, and
Yes.
yeah, if he has an good immune system, then they just get sick much easier and they get better
Yes.
sooner. So if a person wants to work with you and consult with you, how can they find you and what they can expect from visiting with you?
Sure. Well, I mean, a lot of people find me from online, and
Hmm.
they might Google holistic doctor in Houston, and you can find my site Concierge Integrative Medicine of Houston.
Hmm.
Some people find me because they're needing patient advocacy, which is help navigating the medical system itself, and they'll Google a patient advocate, and I'm
Hmm.
like one of the only private patient advocates in not only the city of Houston, but probably the state of Texas, because I've had some people outside of Houston that found me, and they couldn't find anyone
Hmm.
else doing this. So if
Hmm.
you find me, contact me, uh, by email, by phone, and then we'll set up an initial appointment. The initial evaluation is free for 30 minutes.
Hmm.
I'll send a health history form to you. Fill that out. We'll go over it. If you're in town, we'll go over it in person. If you're out of town, we'll go over it by phone or video conferencing, discuss the issues, and figure out a plan, and then figure out what and what in terms of what to do for you and what kind of pricing structure would work best. I have some
Hmm.
that are on an access plan, which is $250 a quarter for a couple hours of time. Comes in my health manual, which goes over a lot of the things that I've talked about here, as well as I talk about with my patients. Uh, I wrote a lot of it down, just
Hmm.
for people who couldn't afford a lot of FaceTime with me, but could follow follow an instruction book, and it goes over
Hmm.
all these things, and I also provide also provide access and guidance with nutraceutical supplements, because a lot of people are taking supplements but the wrong kind and the wrong way and the poor and the wrong quality, and so I get it from companies that are of a high reputation and quality, which I've taken for myself. I've
Hmm.
self-tested it and found it to work. Done it on patients for the last few years, worked for them, and so that's another thing that I can that I sell to my patients, because you can't find it in regular stores. Those who need more time, or need medical services, concierge doctor that they can call for whenever, including not just regular hours, but evenings or weekends. Um, that's a concierge membership. That's $250 a month for 12 months. It's 12 hours of time a year, so which you can use any way you want. Some people see me every month for an hour. Some people mix it up. However you want to. That time is yours, and you can add a second person to it for free. There's no additional cost. You just share the time, and so which now for people in concierge membership, if I'm providing medical services, that is limited to the state of Texas because of licensure
Hmm.
state regulations. But as far as health coaching, if you have a doctor that's taking care of the medical stuff, I can do the health coaching anywhere.
Hmm.
So yes, just contact
Thank you.
and
Thank you. And we will share your website in the post so people can click on it and check it out. So just to wrap it up and be respectful of your time, thank you so much for coming.
yeah,
You mentioned about those six. Let's go back to those six
yeah,
pillars. You mentioned about those six important things that we can all control. We're in control of those. But six of them, that's for some people it's a lot, it's just a lot. So would you give three things that you think are the most important to change to actually get on a better path?
okay. If I had to summarize an algorithm of six, I could simplify it even further. I'll simplify it to
Mhm.
an algorithm of one: get to a normal weight.
Okay.
You know, because that's for most people biggest cause of their diseases: overweight.
Hmm.
Get to a normal
Hmm.
weight, watch your diseases go away. Don't get to a normal weight, watch your diseases not go away, or possibly get worse. Because
Hmm.
and again, it's those six that end up controlling whether you
The weight.
get to normal weight or not.
Hmm.
But that's the biggest thing for a lot of people. And it so I can't, I s- and controlling the weight, the biggest, I'd say, is the nutrition. That's the biggest part, because I had someone once when I was in my medical residency. He's like, "Doc, I can't lose weight. I can't lose weight. I walk an hour every day. I can't lose weight. Why can't I lose weight?" And he's holding a Whopper in his hand while he's asking me this question. And I said, "Well, it's like, look at what you're having. You can't walk off a Whopper." I'm sorry, but
Hmm.
it's just not going to work. Nutrition is 80% of weight loss. Exercise is 20%.
Yeah.
Okay. Well, and so, and of course, sleep's important too. But the biggest thing is with the nutrition. Fix that, get to normal weight, and a lot of your problems should improve, if not completely go away. But
Hmm.
if you're still having it, look to the rest of the algorithm of six to fix those things. Because again, if those things are off too much, you may still have problems. And so that's why I keep emphasizing those six, because it is, we try and break it down to just one thing, but there
Yeah.
really isn't just one thing. There may be one major thing, but
Yeah.
not just one thing alone. So
Yeah. That's why it's called integrative medicine, right?
yes.
Well, thank you so much, Dr. Rajan, for your time. Thank you so much for answering the questions. Well, wish you all happy New Year, and stay healthy in the next year.
Yes, happy New Year
Okay.
to y'all.
Thank you. Thank you so much for coming.
Thank you. Bye bye.